Hi guys, it's your favorite nurse educator, N.P. Clark. And we're back with another cup of the morning coffee. In today's cup, guys, we're going to talk about acute bronchitis. Now, acute bronchitis is a condition where the lining of your bronchial tubes, that's like inside of your lungs, and it carries the air in and out of the lungs. It becomes inflamed. So this causes cough with mucus, shortness of breath, and a mild fever usually. So what causes it? It could be a viral infection. Very rarely is bacterial, but viral infections, usually the same viruses that cause the common cold or the flu. Environmental factors such as pollution. We live in Chicago, so there's pollution, right? So that's also a common cause. Symptoms that you may feel if you have bronchitis. Again, that mucus-filled, persistent cough. So a sore throat, maybe body aches, blocked nose, fatigue, shortness of breath, mild fever, and that little chest discomfort. And it's usually up here at the top, right? Okay, now, as I said earlier, causes. Usually viral infections, right? And on rare occasions, it could be bacterial, and then that environmental chemical fumes, air pollution, things like that. Risk factors for you guys that smoke, cigarette smokers, well, all smokers. I'm just going to put it out there. It's all smokers, but, we like to really pinpoint those cigarette smokers. People that are allergic to certain perfumes, different chemical fumes, exposure to constant dust, a lot of people in wood shops, weakened immune system, and gastric reflux. Now, I thought that was pretty interesting because a lot of people out here have GERD or persistent heartburn. So that leaves you at increased risk for acute bronchitis. How is it diagnosed? In the early stages, it's difficult to tell what's bronchitis and what's a cold, right? Or even from a chronic bronchitis rather than acute. But you have to really look at the symptoms, and that's for your provider to do, right? The diagnosis begins with a physical exam. They're going to listen to your lungs, and then we're going to do some other testing to rule out other infections. So you're going to have, like I said, your physical exam, a chest x-ray most likely, pulmonary function test. You want to see how well your lungs are working, how's the air moving in and out. And then probably a sputum culture to see if there's any bugs in there. And by bugs, I do mean, well, I guess I shouldn't say bugs, but bugs. Let's just go with flu, pneumonia, blah, 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 blah. All of those things. So they're definitely going to check that for you. And then what kind of medications should you think that you may be on when you leave? And you may not be on all of them. Some providers use off-label treatments, but what I would see is a cough suppressant, right? Because it's a persistent cough. A bronchodilator, such as like an inhaler. You want to open up those lungs to get the most air in there, because we already said you're going to have shortness of breath, right? So a cough and shortness of breath, you want to get a bronchodilator. A mucolytic, so like guaifenesin or something like that, and that's just to get that mucus out of there. An antihistamine, antivirals, and an antibiotic. Usually you're probably going to have like a azithromycin. Some people just go straight Z-Pak. But that's really up to you and your provider, what you want and what allergies you have too. And then prevention of acute bronchitis, quit smoking, right? We're going to say that's the main thing. Quit smoking. Increase your water intake, right? Because you want to keep all of that nasal passage, the back of your throat, all of that needs to be clean and hydrated. And then wear a mask if you have allergies, right? Even some seasonal allergies. Masks are are great for more than just COVID, right? Wash your hands. People do not understand, hand washing is a simple thing that we should all do, but it's a must. Get the flu vaccine. And these are quite funny to most of the patients when I say it, but it's true. Avoid salty or sugary foods, high fat foods, and fried foods. So if you're like me, I love a good fried chicken wing. I just made fish for dinner tonight. So I hope I don't have acute bronchitis, but anyway, and I think that's more persistent. Those probably go back to, again, that GERD and that gastric reflux. So whether that's like your stomach's upset and it's coming back up. So again, we want to, I always like to end the video with preventions, right? So going through all of those things. And I really think that we need to really focus on our health, right? We're getting ready to go into the winter, well, fall. Let me say it's going to be fall. And so you're going to have a lot of bugs running around. Flu season's coming up, again, October 1st. So maybe check in with your provider and get your flu shot. And this has been another cup of the morning coffee with MP Clark. Thanks, guys.